Moore, Director of Health for the City of Norwalk. Present, we have today board members Frank Ehrlich, Janet Karpiak, and Norman Weinberger. And we have Health Department staff members Aniela Fignon, Megan Fogno, and Brian Weeks. The first item on our agenda is the public participation. And I don't see anybody here that from the public. So we will open and, oh, actually, I just see a member from the public just joined. If you would like to provide any public comment, please raise your hand now. Not seeing a hand raised, so I'll give it one more second. All right, then we will close public comment at 8:02 a.m. Next item on the agenda is approval of the September 2024 meeting minutes. Do I have a motion?
Yes.
We have Frank motion. Do we have a second? Janet, any discussion on the minutes? All right, hearing none. All those in favor say aye.
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 Any opposed? Abstentions? All right, passes unanimously. Thanks, everybody. Okay, so the biggest part of our agenda today is going to be a presentation on performance management, the annual analysis. You may recall that this is a requirement for accreditation. So we've set up a performance management system. And I don't want to say too much because I don't want to steal from Aniela's presentation, but she's really done a tremendous job working with all the different divisions and staff members across the department to, maintain these dashboards, look at the data, come up with, ideas for improvement. So I just really want to thank Aniela, and I really want to thank all the senior management team and all the staff for all their participation in this performance management system. So I'm going to pass it on to Aniela for her presentation.
Thank you so much, Deanna. I am going to be sharing a presentation with you guys in just one second. All right, and I'm just going to jump right in. So today we're talking about performance management here at the health department. We're going to do a little recap of what performance management is, take a look at our performance management or performance outcomes from this past fiscal year, review some of the achievements and opportunities across all of our divisions in the Office of the Director, review some next steps that we are planning on taking, and then discuss some of the measures and our tactics for approaching our performance measurement this year coming forward. So as a quick review, our performance management system is really in place to monitor the quality of performance of public health processes, programs, interventions, and other activities, improve public health practice, and ultimately improve the health of Norwalk residents. It's an iterative strategic process where we set performance standards to improve or ensure maintenance of desired outcomes, measure our performance based on carefully crafted metrics, report progress quarterly, and use data to make improvements, sometimes with deliberate QI methods. So really, it's like a cyclical process where we set our standards, we collect data, we take a look at how we're doing, we decide if there's any tweaks that need to be made throughout the way, and then, we implement those and continue to collect data. So it just kind of goes on and on and on. It's how we keep ourselves accountable. The way that we track all of this is in a dashboard that we set up in Excel. So a really simple system, but tracks a lot of information. So we set a goal for each of the offices of or the divisions. So I've used the Office of the Director from last year to provide an example to you. So there's a goal set for each division or office, like I mentioned, and then there are objectives for each of the divisions or the offices. For each objective, there's also a domain, and within that domain, we set specific performance measures to capture, sort of our success around some of the activities related to that domain and that objective. We track this information on a quarterly basis. So, from quarter one, starting in July, all the way through quarter four, ending in June, it's based on the fiscal year. And we try to make sure that we are collecting as much information as possible throughout the year. So this past year, we had 104 measures that we were tracking data for. We heard you guys last year. You told us this was a little bit a little ambitious for us, but we did a really good job despite it being ambitious. So 63% of our measures we actually completely met. 9% of our measures we either mostly met or partially met. 7% of our measures were either not measured or the data was insufficient for us to really evaluate. And sometimes what not measured can mean is, it was something that we were tracking just for the numbers. We didn't have a goal in mind. We really just wanted to get some baseline data to understand some of the practices and activities that we're doing and how much time we're spending on them. And then we had 21% of measures that were not met. And we can talk about that in a little bit, about some of the challenges that we faced this year. But looking at how this looks spread out over the entire department, you can see that every division really had a lot that it was looking at, anywhere from 9 to 17 measures or 19 measures. And there was a lot of success across the entire division. So I want to just take a moment to congratulate all of the senior management members and the entire staff on just the great work that they've done this year, because it really does capture a significant amount of work. And really just a ton of time that has been put in by staff on the side of activities and also on the data collection side. So the way that we completed the annual analysis this year is the same as we usually do. It's a self-reflective process where we take a look at successes, challenges, and opportunities. I support the senior management team as they each go through their own individual dashboards. What I do is I provide a tailored template for the division so that they are able to insert their annual analysis and narratives for each of the measures. The division supervisor and their team develops brief narratives that basically give a little bit of body and context to why we did or didn't meet the measure. And then we think about opportunities for improvements and next steps. What are the areas that we might want to, support with additional ideas, things that might not be possible yet, but are, great brainstorming, parking lot ideas. What are the next steps that we can actually implement in the next iteration of the dashboard, and how can we capture that data either in the same way to, capture maintaining numbers or improving numbers, or, how do we change or finesse the measures to capture the data in a more tangible way. And then the last part is that I summarize all those dashboard revisions, and then I put them into a new dashboard, and everybody takes a look and reviews. So this year, some of the things that I wanted to highlight for each of the divisions are the achievements and some of the opportunities that each division or office had. So starting with admin and operations, they had a lot going on this year. They had a major vacancy down at the front desk. And so it was really impressive what they were able to get done this year, despite that, because it did take a lot of, support from other people within the administration and operations division, as well as other divisions. But they were able to get their clinical fees reviewed and updated with you guys. And we implemented them in Q4, which was awesome. We also led an exam room renovation, which was completed with updated appliances, furniture, cabinetry, signage, and features to promote efficiency, decluttering, and reorganizing, and to accommodate a wider range of patients. So, we were really excited to be able to put a bariatric in place and to just make sure that we are aligned with the newest ADA standards. And so that was just really exciting. And if you guys haven't had a chance to stop by the health department and check out those rooms, I highly encourage you to do that, because our health operations manager and our supervisor of clinical services did a great job. It's really looking good. We also had a new security system installed and synced with staff fob devices. So the health operations manager really took care of a lot of that to make sure that we are securing the building more and more as we continue to evolve with the community and with the world. And then on the flip side, we had some opportunities, some areas that we wanted to kind of see a little bit of improvement, or just wanted to open the door for additional additional capacity. So as I mentioned, we did have that big vacancy at the front desk, and so the health operations manager spent a lot of time assisting at the front desk, covering some of that work. And so some of the opportunities there are to catch up on reporting for grants and budgets, basically to alleviate the backlog and increase her capacity. And then another opportunity is to work with the Assistant Director of Health for Environmental Health, Bill Mooney, you guys are familiar, to operationalize and standardize a regular review of environmental health service fees. We've gotten this down pat on an annual basis for clinical fees, and so we want to make sure that we have a regular process for environmental health service fees to make sure that they're all kind of commensurate with what we've got on board. Our community health division also did an outstanding job. Actually, all of our divisions did an outstanding job, but I'm going to say that every time. They had 89 outreach activities this year where staff interacted with residents out in the community. And so that's not in the health department. That is them going out to the community, whether that's health fairs or, like tabling at things, going to events and directly connecting with residents. There was a ton going on. Staff supported 12 families in graduating from the Growing Gardens Growing Health program, which I'm sure many of you are familiar with, which is where we set up families with a little plot of garden land. The community health staff make sure that they are able to tend to their garden, learn about the vegetables or fruits that they are growing, how to cook them in a nutritious way, and how to do it in a family fun way. They also hosted 24 Know Your Number screening events with a total of 166 participants, which is awesome for catching a number of folks with potential chronic illnesses that could be identified and connected to services. And we also had 35 separate presentations at either a presentation specific venue or at a health fair where staff educated NORAP residents specifically about the COVID-19 vaccination. So really excited to have a community health worker on board who can go out and do that work specifically. The community health team is looking to, cross-reference with other divisions regarding community engagement strategies to implement, continued refinement of successful strategies and identifying gaps. They also want to leverage project management software to track and prioritize events by number of attendees, geography, target audience, et cetera, in order to maximize impact and efficiency. And they want to focus on complete and accurate data collection for Growing Gardens, Growing Health. One of the glitches that we kind of ran into, or hitches rather, is that data collection was not perfect. And so that's an example of where we might have grayed out a measure because the data was insufficient for us to completely understand the impact of our work. But overall, you can see the community health team has done a lot of work this year. And what they're really looking to do is to continue to enhance the framework that they're working in. Emergency preparedness also, welcomed a lot of new, people into the emergency response team. We actually had 19 new members join among 2 cohorts last fall and this past spring. And we had all of those ERT members trained in the required incident command system courses, which is 2. Those are ICS 100 and 700. So we're really excited to have everybody, on the same page in terms of training. And then staff also received a number of emergency emergency preparedness trainings related to fire safety, active shooter protocol, and an evacuation plan review. These were all things that staff had asked for, said that they would be helpful to have on a regular basis. And so we're really trying to respond to staff requests on that front. Some of the opportunities that we identified in emergency preparedness are to develop a clearer approach to orient staff members to their incident command system roles in the context of emergency plans, and to clarify, sort of the measures that we have related to staff trainings, excuse me, on ICS. What we have been doing this past year is tracking how many staff members have completed their ICS trainings and provided certifications, but we really want to do an improved job of capturing how staff understand that training within the context of their role here at the health department and in the emergency preparedness ICS framework. We also want to allow additional time to focus on meaningful engagement by current members of the IRT team instead of recruiting for numbers at this point. So we took a pause on recruiting this fall, and we have our wonderful volunteer coordinator. She's coordinating a number of activities meant to continue team building and to enhance the experience for our current IRT members. Our environmental health team was another division that really did an amazing job this year, especially considering that they were understaffed for quite a good portion of the year, almost the entire year. But really want to just applaud them for implementing the new FDA model food code for all of their food establishment inspections. That was a really big process. They trained for quarters 3 and quarter 4 of the last fiscal year, 22-23, and this year, 23-24, they actually implemented it throughout all of their inspections. So that was really exciting to get on board with, this FDA model food code that the state is now promulgating. We also had 100% of housing inspections, including those that were required or mandated for some reason, and those that were initiated based on complaints, completed on a timely basis, which just goes to show that even when we are, understaffed, we are, going out and reaching out to folks to make sure that these complaints are being addressed on a timely basis and making sure that, things aren't just getting left in the dust. They also had the 4 comprehensive lead inspections and 7 lead risk assessments, which is almost like a tier down from a full comprehensive lead inspection. And those were conducted as required under the new lead standards promulgated by the state. Those are taking up a lot of time. So it's really quite an impressive achievement that we've had so many of these completed so far. The opportunities that we identified here are really that we need to hire a sanitarian or a health inspector to fill the existing vacancy that we've been unable to fill due to the current city budget hiring freeze to enhance our capacity to complete inspections. When you take a look at the slides, and I'm just going to go back a couple, you can see that environmental health is one of our divisions that wasn't able to meet as many of its measures as we would have hoped. And that is largely because they were down a staff member and half for most of the year. And so then the next thing that they would kind of want to focus on is body care establishments to improve license renewals and consider additional inspections, which again would require more capacity. But this is an important area where we're seeing a greater need for more oversight. In our epidemiology and informatics division, which is our most recently created division, we had a lot of success. I want to do a big shout out to Brian Weeks for leading this division through, really just discovering itself and figuring out its framework. So kudos to them for, attempting contact tracing for 100% of the COVID cases that met criteria for higher risk, such as pediatric, elderly, communal living settings, et cetera. Presenting and making sure that the public is updated and that our constituents are updated. Did a great job there. Brian provided 27 epidemiological updates to a wide range of audiences, including you guys, the community health community providers call that happens every other Friday, and a number of other groups. The division also develops 15 software solutions for the entire health department, including the Norwalk Air Quality Monitoring Hub and the Norwalk Community Health and Wellbeing Profile, which are all designed for public 24/7 accessibility. So again, just really trying to make sure that we're keeping the public updated and making sure that everything is as accessible as possible. Some of the big opportunities, though, that we are facing here are that we need to find some sort of sustainable funding source to help support the work that's been supported by the epidemiology and laboratory capacity 2 grant, aka ELC2. That's going to be ending soon, and so we really need to look into and identify additional sources to continue supporting the work that's been started by the epidemiology division. So a lot of it is grant-based. We also need to take a look at improving the informatics and technological infrastructure at the health department, including software, dashboards, and web pages, databases, and other components. And really, that's just continuing to enhance the great systems that are already in place. There's always improvements to be made, always more data to add. And so we really look forward to seeing what Brian and his team are able to accomplish. In our preventable diseases division, which is also our clinical services kind of wing, lots of achievements on that end. 100% of our patients were seen and diagnosed with, or who were seen and diagnosed with any one or more of the major reportable STIs received appropriate treatment, which is great to see. We also ranked #1 again in the state for vaccine compliance for the 2021 birth cohort. So our amazing IAP team is continuing to do great work, reaching out to providers, reaching out to families, making sure that children are getting their vaccinations between birth and age 2. And then our WIC office, which is our Women, Infants, and Children's office, which is a state program that operates out of our building, and they're technically our staff. They have been really focusing on conducting outreach activities with the community, trying to continue to spread awareness. So it was really exciting to see that they were able to conduct 15 outreach activities to connect with community providers, and by creating an internal campaign to share important nutrition and breastfeeding information. So despite having an overwhelming number of clientele on their sort of roster right now, they are continuing to expand their reach and continuing to make sure that everyone is aware of the services that are available. Opportunities include continuing to increase that WIC presence in the community through participation in outreach activities. Again, just trying to continue to capture and widen the pool of potential users of the WIC program. There is an opportunity to increase outreach efforts to community providers regarding the sexual health clinic, and continue to maintain our work around communicable diseases and stopping the spread of sexually transmitted infections. Within our IAP program, which is our Immunization Action Program, we would like to see an improvement in the adolescent uptake of the meningitis B, human papillomavirus, HPV, and MCV4 vaccines through the Win-Win-Win program, which is a program where the IAP folks kind of provide incentives to providers throughout the community to get their clients to, receive vaccines. And so hoping to continue to see increased uptake on that one. And then the last kind of area is to maintain compliance with mandated follow-up, considering changes in actionable blood lead levels. As many of you are aware, the blood lead levels, which are actionable in the state of Connecticut, are continuing to decrease, which means that there are an increasing number of folks who are eligible for lead abatement services. So it's really important for us to continue to make sure that these kids are getting the treatment that they need. And then lastly, in the Office of the Director, we also had a number of great achievements. We were able to have 7 internal policies reviewed and or revised and adopted with support of the board. So many of you got to see those policies and see sort of the revision from beginning to end. We were really excited to have 7 done. We continue to work on reviewing and revising additional policies. The Quality Improvement Work Group also met quarterly and finalized the QI plan. So it's really nice to have that QI infrastructure in place and running smoothly. And then 2 tools were developed this year to kind of support the work that we're doing. One is a reaccreditation tracking tool to support staff in our 3rd cycle of reaccreditation as we seek to, kind of see what documentation we're going to have in place, kind of plot and plan for this submission in 2027. And the second tool was a training tracker to make sure that we're more easily able to track progress towards staff training goals. The opportunities that we identified in this area were to reduce the number of strategic plan updates to be consistent with the Public Health Accreditation Board requirements, which indicates that monitoring progress of the strategic plan should be done on an annual basis. It should be communicated with you guys as the Board of Health once a year. So we are going to reduce those updates to once a year. Again, continuing to align ourselves with the sort of standards that are out there for us and not overdoing anything or duplicating any of our work. And then we also really wanted to focus performance measurement on cycles of quality improvement projects instead of completion. As many projects we've found require multiple iterations that can span across fiscal years. And so it looks like we're maybe failing the measure when really we've just decided, okay, like, you know, we've made great progress here, but we want to continue that progress with the project. So we're just kind of shifting the language around that measure. So some of the next steps that I'd like to highlight are, you know, across all of the divisions, reviewing and drafting the updated environmental service fees, identifying potential methods to track performance related to health equity, track and report number of community sites that were provided educational materials on immunizations, continue to work with our public health emergency preparedness consultant to better integrate ICS, that incident command system, into the health department emergency plans so that we can more effectively measure staff comprehension. And it goes back to that, you know, training staff on ICS and their role within the context of our plans at the health department. Develop and implement standardization training or practice process for environmental health staff. So that's, you know, kind of making sure that when they go out to do inspections that there's a standardized process, that they're all sort of coming up with the same results, and making sure that, you know, if there are any discrepancies, that they realign themselves to make sure that there is a standard for how they are inspecting. They'd also like to formalize the process for collecting data around the initiation of housing inspections in responses to complaints. And really what they'd like to do is kind of see, okay, like how quickly did we turn things around in response to complaints. Other next steps are to continue investing in staffing, trainings, and workforce development software and other resources related to informatics as we continue to build out that epidemiology and informatics division. And also continue to ensure that our staff is trained on lots of software and platforms, you know, as they become more and more necessary to our work. Also, as we continue to kind of invest in and seek better platforms that are more efficient for the work that we do. We'd also like to identify a quality improvement coach to deliver tailored training to our QI work group. Something that we found is that it's kind of difficult to find public health tailored QI trainings that are, you know, a little bit flexible and can accommodate, you know, a wide range of individuals who have different experiences with quality improvement. So hoping to, you know, work with somebody on a more one-to-one level and get that specific training delivered to our QI work group. We'd also like to develop a tracking tool to identify accreditation documentation selection and implement it through regular staff meetings. And so that'll be me kind of working with all of the leads for documentation for FAB reaccreditation, making sure that they are sort of plotting everything that they would like to, you know, work on over the next couple of years, and making sure that there's a sort of a schedule in place for reaccreditation activities. We'd also like to track participation in our preventable diseases division in the immunization quality improvement for providers, otherwise called IQIP program, after the IAP team inherited an additional 5 providers to engage in the program. As you guys may know, our IAP team is a 2-person small but mighty team. They do a lot of work. And so it really is quite a bit to have an additional 5 providers added to their IQIP program. But we know that they're going to do wonderfully. So just looking forward to that data. And then last but not least, with the elevated blood levels that are actionable by this, you know, by the state law, We are going to need to continue to focus our attention on initial education of patients while the staffing shortages are addressed. Right now, we are down a public health nurse. We are also down the health inspector or a sanitarian, as I mentioned. And so between the two of those vacancies, it is quite a bit of work to try to find capacity to take on these very comprehensive lead investigations. So what did we do with all of these next steps and creating our new dashboards and thinking about our performance management system this year? Well, we discussed changes to the dashboard and identified specific ones to make with the division supervisors, division staff, and myself. I developed a dashboard based on the division's new measures, and the supervisors and their team reviewed, developed, and revised definitions and details for each measure. The director of health, Deanna, reviewed each dashboard and their final draft, and I made any of the final edits. So they are all in their final draft versions, and we are excited to, get to share those with you when we are completely done. When we were, thinking about what we wanted to keep in the dashboard, especially considering, that last year you guys told us, we're doing a really great job of being overly ambitious and are maybe tracking a little too much. So we wanted to think about how to sort of capture the most important things in our dashboards. So we had a couple of key considerations that were part of this process. So we really wanted to make sure that measures aligned with existing plans or mandates or, things that were already in place that we knew we had to do. So we looked to see if measures aligned with the Community Health Improvement Plan or the CHIP, whether they align with the Quality Improvement Plan, our strategic plan, or our workforce development plan, grant deliverables, whether there are federal, state, or local mandates. And so again, really just trying to see why are we measuring these things? Is it something that, aligns with the work that we are already doing? Or does the measure create an extra lift? Are we creating another activity for ourselves to engage in just for the sake of it? We also thought about what the purpose of the data collection is, so is there anything that we can actually do with the data, or is it just tracking numbers and, we won't really be able to do much with it? And then we've also thought about data collection. So how easily attainable is the data and who will collect and or record the data? Because with so many measures in place, it was a lot of going back and retroactively pulling numbers and data. So we wanted to make sure that all of the performance management process was easy, efficient, and not a burden on each division. So this year, as I mentioned, we really pared down the number of measures. We actually got that measure total down to 76. So that's 28 less from the 104 that we had last year. So we really heard the Board of Health's advice and took that and really took that into consideration and implemented it. And so what tracking a smaller number of activities means is that we are cutting measures that are related to activities that have become standard operations. So there are things that we know now. We've tracked them for a couple of years. We've gotten good, data collection that indicates, success. And so we know at this point, we're doing well in that area, and we don't need to, continue to collect the data unless we notice some sort of a hang up or something changes in those operations. We also wanted to make sure that measures included capture more meaningful data. So, again, not just tracking things for the sake of tracking. We didn't really want to track the number of things, if it didn't really have a bearing on, our capacity or how much work we've been doing out in the community. And so that also meant reduced retroactive data collection, which is a lot more efficient. We just want to save time all around. And we also want to make sure that, people are not having to go back into their platforms, months later and figure out, okay, let me crunch these numbers. It really should be something that should be as easy as possible. We also wanted to see improved alignment between each division's staff capacity and the required measures. So again, that's why we pared down quite a bit, because we don't have the capacity that we would like at the moment. And we also placed a bigger focus on activities mandated by grants, plans, regulations, things like that. Again, the requirements, the things that we know that we have to do while we are short on staff. Some of the examples of updated measures are number of QI projects that have undergone a complete PDSA or other QI methodology cycle. So again, that is related to our quality improvement system and capturing iterations of QI projects and QI cycles rather than the full completion of a project. We also developed a method to develop a reaccreditation preparation tracking tool. So that'll just kind of keep us on track for reaccreditation. Number of community sites that were provided educational materials on immunizations. This is one where the community health team really wanted to continue to capture the work that is being conducted by our community health worker who's focused on COVID and other immunizations. The percent of violations for which abatement was completed. So now, instead of just tracking the notice of violation numbers and then the number of abatements that occurred each quarter, we're actually trying to calculate the percentage of abatements that were completed. And while we know that the numbers will be, a little off because each violation is not necessarily abated within the quarter. A violation could happen on the last day of a quarter and then it's abated in the first day of the next quarter. We want to be able to see, just how well we are doing in that area. Another one is number of software trainings for NHD staff. So Brian in the Epi-Informatics division is really looking to, as I mentioned, kind of make sure that our staff are, better trained and better prepared for all of the new systems and platforms that are out there as informatics continue to change and really have a lot of weight in our field of public health. And the last example is the percent of providers in the catchment area participating in the IPIP program. So as I mentioned before, our preventable diseases division and our little two strong but mighty team of IAP folks, did inherit those additional 5 providers. And so they want to make sure that they are, tracking the participation of all of these providers to see, whether having that additional 5 providers added to their workload makes a difference or not. So those are some of the highlights from this year. And really some of the big takeaways that I want to share with you guys is that we had a lot of ambition across every division. We still do. It was really hard for us to chop a lot of these measures and not say, oh, but can we add something related to this? Or can we add something related to that? Everyone wants to be doing as much as they possibly can, but we really need to make an effort to focus on the most important measures that are critical to our deliverables. And so what we really did was focus on the efficiency and value of our performance measures to make sure that we are focusing on, again, the most important things. And I'm going to turn it over to Deanna because I know that she wanted to share a couple of thoughts related to this. So I'm going to stop now.
Thank you, Aniela. Thank you for that really, really great presentation and overview of all the great work happening across the department. So my biggest takeaway is really about the staffing and capacity, sort of what Aniela's already discussed. Like, we do really well when we have the people in place to do the job. But, we do have resource constraints in certain areas. That vacancy for that sanitarian, we had a challenge to hire that position because the field of professionals out there in Connecticut is not as great as it used to be in terms of people that have the registered sanitarian. They have that RS designation, they pass the test. It's harder and harder to find people that are food certified. So there's a lot of work right now that's going on at the state level and local level to get more people ready and in place to be able to work in local health departments. But that hurt us, as well as the hiring freeze that was put in place. So that's why a lot of, as Aniela said, a lot of the environmental measures weren't fully met. We have been able to hire someone part-time temporarily to help with some of the restaurant, the food inspection. So that's helped us for this current fiscal year, and I'm hoping to fill that vacancy by January 1 of 2025. I also want to point out, the lead inspections, as Aniela talked about, the the state statute changing and the additional volume of work related to lead. And so that's obviously going to be a priority to us. And so we're just still trying to figure out, the staffing for that, because the work is only going to get greater. We had put in the budget request last year for one of our part-time staff members to be full-time. That wasn't able to be funded last year. But I do want to continue to advocate for that additional resource at the health department, because that work is really critical, and it is a state mandated function for us. And then also just with admin, as Danielle talked about, that receptionist position being vacant just goes to show how critical, important that position is, and how people were pulled from different areas of the department, as well as within that division, to cover for that critical position. So that made us behind in some other things, but just wanted to highlight those as sort of my biggest takeaways. And I guess now we'll pass it on to you all to see, the board members, if you have any questions or comments or highlights you want to share. Thanks, Danielle. All right, I am not here. Any questions or? All right.
Just a comment, Aniela, that was incredible. I'm sure I speak for all the members of the board, and thank you for the work that went into my comment is not related to your report. It's related to keeping the board informed about those areas where we're faltering a bit, and it's not anyone in the department's fault, i.e., if you need staff and you can't get the staff, maybe because there are none out there, maybe because you don't have the money for it, that should be broadcast to us. We should know that. We may not be able to help you, but on the other hand, we may. And I think keeping the board informed of those areas, like the lead issue, that's not your fault that we're faltering a bit there. At least it didn't sound like anyone in the department had any issue or blame for it. But the blame lies somewhere. Somebody, for anything that you falter on. And I think we should know those things. If you know them, we should know them. That's it.
Thank you, Frank. I appreciate that. We will definitely keep you informed, and we have these updates, but we'll figure out ways to do more of those updates. We have to schedule more of the one-on-ones too for the rest of the year too, so we can have those discussions too.
Just Ken, one other area that I didn't see if there was focus on there, I know I came on a little late, is the development of critical partnerships, especially with what's going on with the hospital systems and those kind of things. So do we have somewhere as a placeholder, if nothing else, that we would make efforts to mobilize the right team as those changes in the marketplace take place? So,
I don't know if you know the top of your head, I feel like that's included within, the strategic plan, the partnerships. I don't know if it's, I can't remember if it ended up being a final measure and then the community health dashboard for this year. I don't know if it has been or not, but.
I don't know if it's specifically about critical partnerships. We have measures that are related to community engagement strategies. So it's one measure that is sort of covers, how are we going to engage with the community? And so we track the number of different strategies, and there are, pretty comprehensive, explanations or notes around that. And so it could be a wide range of community audiences, whether it's a a small organization, whether it's actual members of the public, or whether it's a more critical partner.
Thank
Thanks,
you.
Danielle. Thanks, Ken. All right. Thank you, Aniela, again for your great presentation. And next item on the agenda is the epidemiology update. So I'm going to pass it on to Brian.
Hey, thank you, Deanna. Hello, board. Hey, everybody. So I'm just going to do just the standard kind of quick overview, our favorite thing to talk about, respiratory viruses, as we just kind of keep tabs on it. And again, this is just kind of a presentation intended for you guys and any viewers, just to make them aware. It's a situational awareness update. So with that said, jumping right into it, going straight to the CDC Respiratory Illnesses Data Channel, which again is a great summary and a snapshot of kind of what's going on. As you can see here, for the current snapshot for the United States, overall respiratory illness activity is low, which is good, right? We're still in the early stages of the season, so that's what you would anticipate. Still, we're coming down from, what has been higher summer COVID activity. So that's just another important thing for us to kind of keep in mind that, COVID is still circulating at, levels that could still result in further transmission and complicate things down the line. And so with that said, wastewater activity levels for the United States, COVID's at low, flu and RSV are minimal, which is nice. And again, the flu that's being assessed for with the wastewater monitoring is only flu A, not flu B. But flu B typically we see come later in the season. And then we zoom in for the snapshot for Connecticut. Kind of same story again for the country. So it's good that we're kind of mirroring national trends too, which is that low activity, but COVID kind of being that primary driver. And so we'll go into this greater detail just really quickly again. So the CDC has updated a lot of their visuals for the season, which is great. So it gives us a different way of looking at these things. So this is loading out with the respiratory illness activity, the acute respiratory illness metric. So it's a replacement for influenza-like illness. So the great thing about it, it offsets for even having fever or no fever. So it gives us a much better spectrum or view of respiratory viruses and illnesses going on in the country. And so you can see it by state, in terms of activity. So right now, including Connecticut in the Northeast and much of the eastern part of the country, we're at low. But then you can see on the West Coast, they're at minimal. So we are a little bit higher than comparatively the West Coast and the western part of the country relative to that metric. Looking at the wastewater monitoring, which is still our most helpful metric and also a predictive metric in terms of letting us know where things are going before the hospitalizations and the ED visits show that data. You can see here by state for COVID-19, Connecticut at low activity, but other parts of the Northeast, especially in New England, kind of in that high level. And then you also got other states like New York or Pennsylvania or Maryland, kind of in that, high and moderate activity as well. But you can see, interestingly enough, compared to kind of that acute respiratory illness metric we were looking at before, parts of the western part of the country are experiencing, a lot of that very high and high activity too. So it is kind of interesting because, again, this is an indicator where things are going. And so that should be reflected down the line for that acute respiratory illness metric. And so this is COVID-19. Looking at flu A, keep in mind, this is going to be slowly picking up as well. You can see Rhode Island kind of at the moderate level, along with other parts of like the mid-Atlantic of the country, as well as the Southwest. And so, that just means, again, even though it's indicating for Connecticut minimal activity, there is still flu A activity going on, and it's going to only just keep increasing. So it's kind of on track with what we expect chronologically in terms of time, or temporally. So that's kind of at least good in that sense that, it's following kind of what we anticipate. Same thing for Rhode Island, again, for RSV. So it is showing low, which again is our neighboring state. So it is kind of important to keep in mind that RSV activity is also going to kick up too. And so again, all three of these respiratory viruses we have vaccines for, so it's just important that everybody kind of keep that in mind. This is the emergency department visit, so this is another kind of perspective on this, as we're all very familiar with, especially my reporting out from the last season. And so you can see here how we had that kind of bump in COVID activity in the summertime, and it's, very dramatically decreasing, which is great. But you can see how flu and RSV here, in blue and the purplish or magenta, whatever color you want to call it, respectively, is kind of showing a little bit of that uptick. And again, this is national trends. So just like mirroring that snapshot we were just seeing before. You can see the same kind of story with Connecticut, just a little bit more jagged of a curve. And then along with that, zooming into just Fairfield County. So again, Fairfield County mirroring kind of what's going on in Connecticut. And then there's this really great new visual from the CDC called epidemic trends. So basically it's factoring, the emergency department visits into a trends model and kind of interpreting it and kind of indicating where things are going to go. And so, or likely going. So as you can see here for COVID-19 by state, you can see everything that's in a shade of green is indicating a decline. Now, the lighter shade of green is a likely decline as opposed to a higher probability decline for the darker green. And so the same implies, or the inverse applies to the magenta or purple color. So the darker the purple indicating, definitely a growth. And then a lighter purple, a likely growth. And so a lower probability growth, but still it's there, and the data would suggest that. So right now for COVID-19, Connecticut's in a not changing state. So we're kind of in that middle ground. And so as we know, especially as Halloween happens, but more importantly, as we get to November holidays and Thanksgiving, especially, that's where things really do uptick. So they only have it for COVID and flu, and you look at it for flu, you can see how that purple or magenta indicating growth for flu is very apparent in, again, the Southwest, West Coast, Midwest, and then also parts of the Northeast, including us, Connecticut. So it seems like New Jersey's kind of bucking the trend there in terms of being likely declining, but, comparatively, you have a lot of not changing status for most of the other states in the Northeast, for the ones that do actually have data that's been estimated. So again, that means a little bit of just, again, what we're going to see with the later in the season with the uptick. And so Connecticut's poised for that, for definitely for flu. And then it's a matter of how COVID plays out, because, the pros and cons of and the benefits of having that uptick in the summertime means a lot of people did get infected with COVID. So they are retaining some of that recent and natural immunity alongside those that are actually getting the vaccine. So that's, again, really important for those that especially didn't get sick in the, the summertime to get the vaccine, but everybody too, as well in general. So we want to just make sure that immunity is as high as possible to reduce the severity outcomes, as well as reduce the opportunities for some level of transmission too. So with that said, just as a reminder for everybody, again, if you haven't gotten these 4 free at-home COVID tests, please do so. Again, that's covidtest.gov. It's a really easy website, very easy to order it too. It's very, very easy. It just takes, maybe a minute just to do it. But, and there's also just other means to order this instead of just via the web link, which, you can kind of click here. You can kind of call these numbers, the 1-800-232-0233, or even a talk to you phone number of 1-888-720-7489. I just want to hit that home because it's good to have the supply ready in terms of one's household, just so, as kind of respiratory virus, season kind of plays out, you have the ability to test yourself and know your status and take the proper precautions, as we're all very familiar with. I won't hit this home again, but, again, you have these 5 core prevention strategies with the immunizations, respiratory and hand hygiene, access for cleaner air, treatment, then obviously staying home, for until symptoms are obviously reduced, and one's fever free without any sort of fever reducing medication for 24 hours, and then 5 days taking those precautions as outlined, alongside the additional prevention strategies with the mask and the distancing, and also just the repeat testing as needed, right? So just want to hit that home. I guess I glossed over it, so I did mention it again. Changing gears real quick. For vector-borne disease, specifically mosquitoes, just kind of covering that. We did have our first frosts about a week ago, which is nice. So that does kind of really reduce the activity relative to mosquitoes. There's still maybe some, mosquitoes that have been successful in making it through that freeze and any other kind of cold, fronts that we had. So that's just important for us to keep in mind. That's still there, but it's very much reduced. Because as you may recall in prior presentations, we've had an abnormally active mosquito season, especially that's in terms of West Nile virus positive mosquitoes, which you see here in the yellow, which includes, Norwalk in kind of ground zero in lower Fairfield County. But then alongside, also the Triple E situation that has made its way even to Fairfield County. Here in Newtown and Trumbull, as you can see, even, 1 mosquito each that has tested positive for Triple E, but then also, in Fairfield County, also a horse, presenting with that too. So it's also just important to keep in mind, because this has been abnormally high for a Triple E, which, it's not something we want to see, especially even neighboring states like Massachusetts and New York. And even Rhode Island too, have also seen, triple E activity that's abnormally high. So this has been a unique situation. And then current predictions for our forecast for the winter season is indicating that potentially the Northeast, this is from NOAA, is going to be kind of a, a little bit warmer than usual season as well. So that's not great for vector-borne disease, ticks and mosquitoes, equally. So that's just important for us to keep in mind. But we'll see how it plays out, right? Because these are forecasts. And so finally, just mentioning really quickly, just for our general knowledge, 2 more CDC HONs have come out since our last meeting. Number one, that is, we've been very closely monitoring and the CDC has been providing updates for, is, Marburg virus disease outbreak in the Republic of Rwanda. So this came out on October 3rd. So actually, this is even out of date relative to that. So it's actually resulted within the last week or so in terms of the data updates from the CDC and the most recent one that they provided, about 62 illnesses and 15 deaths related to it. So it's something that they're very closely monitoring. And there's also prevention measures and actions that are tied to it, especially people traveling from Rwanda, especially, in areas that are experiencing this activity. So working with the State Health Department and along with that, obviously the CDC, but this is just good for general awareness, in terms of just seeing how this plays out. But so far, risk is very low. There has been no cases that presented in the United States so far, knock on wood. But it's just, good for us to be aware of that. Along with that, just the disruption, in October 12th, there's one in regards to peritoneal dialysis and intravenous solutions from Baxter International Facility in North Carolina, and that's related to Hurricane Helene. So it's also just good from a situational awareness perspective, especially for our providers. Just knowing that the supply chain does get disrupted whenever we have these kind of severe natural disasters. And so it's important to keep that in the back of our minds, also from a preparedness standpoint too. And so just wanted to share that news out. So that, again, those are kind of the 3 major items in terms of just the respiratory virus update, vector-borne disease mosquitoes, as well as the 2 recent CDC HONs. Thanks again.
Thank you, Brian. Does anybody have any questions for Brian? Thank you, as always, for covering all these really important topics. You're doing a great job. All right, I'm going to do very quick director's report to close us out. Want to thank the staff for all the work they've been doing to support the flu clinics. Community Health and Parental Diseases have been leading that. Kelly Thomason, our health educator, has really been leading it and working with staff across the different divisions. We had 2 of our community flu clinics so far. Joan, who isn't here this morning, but she's one of our emergency response team volunteers. She volunteered at one of our clinics, so I want to give her a shout out for her assisting us with one of our clinics. We had over 80 people, I think, at each of those clinics, so it was a great turnout. It's great to see community coming out and getting vaccinated. We have a vacant grant-funded public health nurse position and a vacant public health specialist analyst position. And so the grant-funded position for the public health nurses is out there now. So we're looking for applicants, and then we'll be posting the analyst position soon. We are looking at doing some more improvements to our exam rooms, in particular improving the ventilation. And so we're hoping to get that wrapped up towards the end of this year. We're also supporting the city is looking to do, they're doing an online permitting software project. And so there's many different departments that are supporting this. And I just want to let you all know that I'm helping to lead this right now. Our Chief of Economic and Community Development, it's a vacant position right now. She had been leading it. She left for a different position. And so several of us are helping to move that project along for the city. And so, the health department will be a big part of that. And then at the Common Council tonight on the agenda, we have a extension of affiliation agreement with Sacred Heart for the nursing program to be able to continue to host student interns. That's been a really successful partnership between the health department and them. And I also just wanted to make sure you all knew that it's Lead Poisoning Prevention Week. And so we'll be doing some outreach and we should be sending a press release and other information out there to the community about this important week. So I think those are, and it's 9 o'clock, so we wrapped up right on time. Any questions before we adjourn? All right. Thank you, everyone. Have a great day.